30th, 2026 meeting of the Metropolitan Audit Committee. Detect a quorum here for us today. And so I'll call the meeting to order. First up on the agenda, any public comment?
Yes, there is one public commenter signed up, and that would be Aaron Evans.
Hello, Aaron.
Hi. Good afternoon. Chair and members of the Audit Committee, thank you for the opportunity to speak on the Opioid Settlement Fund audit. I'm Aaron Evans. I'm the Metro Council member for District 12 out in Hermitage, and I was 3 times the chair of the Council Public Health and Safety Committee. So I want to start by acknowledging a positive that this audit didn't find that the Metro settlement or audit settlement work is misaligned with the public use of funds, which is awesome. The audit found that the program delivers services aligned with treatment and harm reduction and primarily follows the recommendations of the original Opioid Settlement Steering Committee, of which I was a part in my first year as chair. The audit also identifies serious public trust issues that need a clear correction or corrective path. The first is the high-risk finding related to payroll allocations, which you all have read as part of your findings. These are restricted, finite dollars intended to address a devastating public health crisis, so I believe that that finding really deserves serious follow-up. The second issue is the lack of formal governance and oversight. And the audit says that the Board of Health met 45 times during the audit period, and opioid settlement fund activities were mentioned only 1 time. And so to kind of give you a comparison, Metro Animal Care and Control during that same time period, they had a variety of presentations, grant acceptances, also during that discussion period with the Board of Health. And it just kind of shows that they had 45 recommendations or information that was received by the Board of Health compared to the opioid settlement funds, which got that 1 mention during 1 meeting. And so I think what's the most disturbing part of the audit is really the rejection of the word oversight. We have had other issues related to the use of the word oversight with the Board of Health in conjunction with Metro Animal Care and Control, the focus on the use of the word advisory. And so I think what we're witnessing kind of related to this audit is, I would say, a political will issue of essentially trusting but not really caring for the obligations of the Board of Health. And so I would recommend that the Board of Health take more action. Thank you.
Thank you. That's all we got for public comment?
That's all the public comment.
Okay. Approval of the minutes. I need a motion to approve the number of discussion.
Second.
All in favor?
Aye.
All right. So first up is new business discussion of the external audit plan for the year ending June 30th.
Yes, that would be presented by our external auditors, Crossland.
John Crossland. This is Philip Gonzalez from Crossland. I know you have a packed agenda and a lot of people waiting for things other than this, so I will move through this pretty quickly, but especially if you haven't heard this before, please stop me, ask questions, dig in. We could stay all night if you'd like, but happy to talk about anything. Each of you should have this presentation. I'll start with page 1 on the agenda. I'm going to go, here's the items I'm going to go through quickly. And team members, we do have a couple of changes. Our responsibilities as opposed to management's responsibilities. The fact that we are independents, how we consider fraud risk. What is our audit methodology? What is our approach? How do we audit? How do we tackle the entire city of Nashville in one audit? The single audit, a reminder, is that is your audit of your federal grants. So I'll talk a little bit about that. Any significant activities or prior year issues. And then I'll go through a few of the new GASBs that have been issued just to let you know what's out there, timeline and deliverables. So on page 2 is our engagement team members. This has remained unchanged with the exception of the addition of 2 managers. Philip Gonzalez here, and Sarah Simpson is also added to that as the audit manager. They're sprinkled throughout here with, along with J.D. Cage to handle all these areas as far as the management process. Jennifer Monternock is also returning as independent reviewer on a lot of the audit and also leading up the schools, the Nashville Public Schools and the internal school fund audit. Page 3 gets into our responsibilities as compared to management's responsibilities. So our responsibilities are to express opinions about whether the financial statements in this first paragraph are prepared by management under the oversight of this audit committee, are fairly presented in all material respects in conformity with GAAP. We will obviously perform our audit in accordance with government auditing standards, but also with the uniform guidance. Reminder, the uniform guidance addresses the single audit, the government grants. Our responsibility is to maintain independence in fact and appearance and an attitude of professional skepticism. And then we also are required to report to you guys, especially if we have any findings and material weaknesses or significant deficiencies or any other kind of non-compliance with the federal grants. Management, on the other hand, they're responsible for fairly presenting the ACFR in accordance with GAAP. They're responsible for adapting proper accounting policies in which we audit, and establishing and maintaining internal control, preventing, detecting fraud, and disclosing also to this committee and to us if they detect any fraud in any instance. Page 4 is independence. We are independent with Metro Nashville in accordance with the ICPA's Code of Professional Conduct Rule 1, Rule 101, as well as government auditing standards. For the most part, they're uniform these days, but generally the government auditing standards is a little more stiff as far as independence goes, but it doesn't matter, we're independent of both. Page 5 goes into fraud risk. I mentioned SAS 99 here because even though it's been out for quite a while now, probably 20 years, it specifically addresses how external auditors are responsible for fraud. It's not a forensic audit, and so auditors used to kind of just wipe their hands clean of it and say this isn't our responsibility. SAS 99 came along and said, okay, well that's not acceptable. You got to do something. You've got to, in these 4 different categories, you've got to have engagement team brainstorming. You've got to inquire of management, not just the top finance people, but in various different departments throughout the city. Inquire of, have you heard of any fraud, or are there any personnel that you suspect that might be doing something, stealing or doing something fraud related, and then investigating those unusual occurrences or transactions. And that's kind of responding to the risk. It helps us now identify our risky areas, not just if there's deficiencies in control or if there are material items, but also if there's a fraud risk. It helps us identify where risks are. We also test management override. Can management have solid internal controls, but somehow are overriding the system? And then finally, the last category, just evaluating all the evidence that we've put together and properly communicating that primarily to you guys. Page 6 is our audit methodology and approach. We have it in a chart there on the left, but it also addresses the main 4 things. Right now, what's going on is audit planning and risk assessment. You can't audit until you've assessed all your risk, and that's where audits change from year to year. You can have the same people and the same client, but depending on what's going on within that, in this case, government, it changes where those risk areas are. Evaluating controls. Are there controls you can rely on? Are there areas that you can't rely on controls? Substantive testing and completion and reporting obviously is the goal with the ACFR. Page 7 is a little deeper dive in that planning and risk assessment. We've identified general areas of management override of controls and improper revenue recognition as the main areas that typically for any government, honestly, is material weakness is the highest risk. The left box at the bottom of 7 is where we've determined that we can test controls and we can rely on those controls in lieu of substantive testing. which is over there on the right side, and these are the areas that we're primarily going to be doing substantive testing, like pulling invoices or confirming cash with third parties or investments or, recalculating property taxes or, down in the hospital, there's a couple specific areas relating to patient accounts. Page 8 addresses the federal grant auditing, the single audit. Metro Nashville, we have determined is a low-risk auditee. How we got there is determined by the O&B, but it does have some judgment for us. Metro, since we've been involved, hasn't always been low risk. There were a number of years, probably 10 years ago, that they were high risk. Primarily it's because we have not had any material weaknesses reported or any compliance findings in that single audit in each of the last 3 years. It's actually been longer than 3 years, but 3 years is a determination of automatically triggering a high-risk audit if there's material weaknesses. We have not had any. As a result of being low risk, we have to cover 20% of your test, 20% of your federal expenditures. If you are high risk, we'd have to test 40%. So obviously that's double the work if you were high risk. We do not have a CFA for this year yet, which is the Statement of Federal Expenditures listing. It'd be too early to have that yet, but we have tried to predict what our major programs that we would be focusing on this year. We've listed those on this program. Obviously, very subject to change.
Can you just speak into that again, that acronym CFA, a listing? Would that be
Yeah,
specific to metro government, like all the
Specific to
federal
metro
funds?
government, yes.
Okay.
It will be, in Metro's case, probably a 20 or 30 page, think of a 20 or 30 page Excel spreadsheet of every single federal expenditure listed by each grant, like Department of Education, Special Education Cluster, IDEA. Metro government spent, say, $1.7 million on that. And then we go through the entire 30 pages and we assess the risk on every single grouping and see where we need to focus our testing.
Is that something that the federal government prepares and establishes for each
The
government
OMB,
independent of Nashville?
The OMB sets the guidelines that we have to follow to determine those programs. They don't specifically mention programs, but they say, for instance, it's moving from $750,000 to $1 million. But say a program, any program above $1 million is a type A. There's type A and type B. Type A is where generally the focused testing is. So anything type A is considered, over $1 million is considered type A. That means we're going to go in there and do a risk assessment of that program. And we either have to test it or we have to say, well, we tested that grant last year and we didn't have any findings. So we can do that one every third year.
So are you aware of those across multiple department budgets, or does the Department of Finance aggregate all federal spending into one kind of singular document?
They aggregate
Okay.
it.
So that exists as a...
And some of our testing is make sure, obviously, the list is complete.
Yeah, okay, I appreciate that. That would be an interesting list, okay.
Yeah.
You're expecting that when?
We're expecting to issue that by the end of December. We'll issue the ACFR first, and then we'll start the testing while we're testing the ACFR, but that's usually the second stage to finish up by the end of December.
Okay.
Yeah, we have to upload it to, it's called the Federal Clearinghouse.
Thank you.
So from a federal level, we upload that report, and then also from a state level, we upload the ACFR to the comptroller's office. So there's some overreach, not overreach, there's some, whatever you call it. Yeah, I got you. Any other questions on that? Okay. Page 9, last year we did not have any material weaknesses, significant deficiencies, or compliance findings, which is fantastic. We presented, I think at the last meeting we were here, we presented a management letter comment, and we only had 1 or 2 small comments, which is the least we've ever had. So it went very well. I expect the same this year. Page 10 are new statements that are coming out. Two of them, have come out. Two of them are applicable to 2026, GASB 103 and 104. 103 is an update to GASB 34, which came out about 20 years ago, that restructured the entire governmental report. This is just to improve on 34, readability, comparability. It focuses on a few areas. The MD&A is going to change a little bit. Presentation of proprietary funds will change a little bit. Just some enhanced disclosures. So we'll work obviously very closely with the finance team to make sure all that's in the ACFR. 104 is another disclosure. It's just capital asset, enhanced disclosures on certain capital assets, not all capital assets. And then 105 will not be applicable until 2027. And again, it's just making the current rules around disclosures and subsequent events a little more clear. So none of these are debits and credit changes, if you will. It's all presentation.
Quick question.
Sure.
So updating GASB 34 on reporting models, what I heard you say was for legibility, comparability.
Like readability,
Right.
comparability. Yeah.
I mean, are you talking as simple as something like ADA, or more so getting into the numbers and saying 4 years ago we did this, thus over time we did that? Because we've had some inquiries relative to our own budget process, right? How do we make it more legible and accessible?
A little bit of both. Even with, you mentioned budget, that's one of the things too, is consistently requiring budget information across multiple governments to be comparison.
Okay.
So you could look at Metro Nashville and you could look at Knoxville, and the same budgetary schedules are in there.
Okay. Got it. Okay, thank you.
Page 11 is our timeline for all the different issuances. The ACFR at the top, the uniform guidance, the compliance audit into December. Public schools has two segments with the school activity funds and the schools. School activity funds will have its own report issued by hopefully by the end of October, but definitely during the year. All this should be out during the year. Hospital is made the bold goal of being out by the end of October, and they're working hard. So.
Question. For the MNPS and for the hospital authority, it's instead of like a one bar, it's like a gap in between. What is that representing?
Interim and final, really.
Okay.
Yeah, we kind of, some audits we come and go, like even the hospital authority, like we have some interim work, and we, like the hospital, we had to do an inventory observation last week.
Okay.
All their drug supply, we had to go in there and count. So that's what that little piece was. For Metro Public Schools, that would be a great question for Jennifer, but I think it's some interim work.
Thank you.
She's the lead on that, but yeah. Page 12, just a list of deliverables and anticipated completion. Really what we just went over, except adding the management letter and the data collection form I had mentioned. And then finally on page 13 is just a list of contacts. And anybody is more than welcome to contact us anytime throughout the year. Great. Be happy to answer any questions.
Thank you, sir. Anybody? Oh, there we
Just a
go.
quick question. Yeah,
Yes.
you mentioned Jennifer.
Yes.
Is Jennifer primary assigned for MNPS?
Yes.
Okay, got it.
She's the lead partner.
Okay, got it.
Yes.
Thank you much.
Miss? Calls? Thanks.
Okay.
Thank you.
Yeah.
You can send in the next
We
group.
will. Appreciate you.
Let them know some Nissan Stadium people is what we're looking for.
Say they should know.
Stadium people?
There you go.
brought the crew today. I can stand.
We just did.
All right, Lauren, I'll turn it over to you.
Okay, so we engaged Baker Tilly to perform interim audits of the Nissan Stadium construction project due to its size, complexity, and cost. And so they will perform construction audits as they have more of a construction expertise. That's the way construction audits should happen, is while they're going on. And so the first interim audit has been issued. So I'm going to turn it over to Erica Hightower with Baker Tilly.
Good afternoon. I'm Erica Hightower with Baker Tilly. I am the principal who oversaw and is still overseeing the work on the audit. Thanks for the opportunity to present. As Lauren mentioned, we were engaged by the Office of Internal Audit to conduct an audit of the design and effectiveness of internal controls related to the construction project. Before I get into the scope, I did want to just extend my thanks and appreciation to all parties involved in the audit. As you can imagine, there were several different parties and hundreds of people that needed to cooperate in this, and we really appreciate everyone, including those of you who have come along for today. So with that being said, our scope covered the period for this particular audit. Our scope covered the period of April 26th of 2023 through July 31st of 2025. So that covered really the beginning of the project through kind of an interim point, and our next audits will pick up further along in the project. For this particular audit, we focused on 5 primary areas in our scope. That included governance, oversight, and public accountability, schedule and delivery management, financial management and reporting, procurement, and design, construction, and contractual compliance. Overall, I'd say the results were pretty positive. We did not identify any high-risk observations. Instead, we identified 1 medium-risk observation and 2 low-risk observations. Before I get into the detailed observations and management action plans, any questions on the scope? Okay. So for the first observation we noted, this is again medium risk, and it involved quality management documentation. During our testing, we noted that certain non-conforming conditions identified by the project team's architects did not always consistently make their way into the centralized quality management system. The issue here primarily stemmed from varying interpretations of what was considered non-conforming between the construction manager and the architect. I want to emphasize that we did not identify any quality issues. This doesn't mean that there were things that were not resolved that should have been resolved. It was more related to the documentation in matching one for one what the architect was picking out and what was entered into the system. So we recommended that the project team gain conformance on or gain a defined process for what constitutes a non-conforming condition and making sure that those are entered into the system. Along with that, we recommended that the architect have access to the quality management system to be able to directly enter those as well. And to resolve the issue, the project team provided the architects with direct access to the system, and they enhanced procedures to ensure that all non-conforming items were tracked and resolved.
Can you give an example of what is a non-conforming condition?
Sure. So I might need some help from TVA if I butcher this, but anything that the architect really identified as not constructed according to specification, and again, it could be anything. It could maybe there's a crack, or maybe there's a slight angle difference or a slant. It can be really anything that does not fit what was on the specification of the design.
So that seems pretty black and white. If something should be at a 90-degree angle and y'all measure it at a 75-degree angle, that seems very black and white. So why would there be a discrepancy between one entity thinking that it was non-conforming and another entity thinking that it was in compliance?
Based on our experience, the way that these items were logged into the quality management system, some of them were tagged as non-conformance, some were tagged as work in process.
I see.
So it was really hard to tie, really from an audit trail perspective of here's what the architect is calling non-conforming and here's what the construction manager is tracking as non-conforming. It just was impossible to do a one-for-one check there. So the issue stems really from a lack of clear documentation, stemming from the root of that definition of non-conforming or work in process or other terms.
Thank you. Just one more follow-up question.
Sure.
So, do they then come back to make sure that the item is now conforming?
They do. Yeah, so the architect has their own historical documentation of what they noted was non-conforming, and the architects are consistently and constantly inspecting this construction site, so they're out there. Is daily fair to say? So that they're out there and they are definitely aware of what the issues are, and they're making sure that those are being consistently resolved.
Thank you.
May I ask just a follow-up question?
Sure.
So architect of record versus engineer of record, or one and the same? Because to Ms. Porterfield's question, there's one thing like, oh, you know, the edge on this counter isn't quite compliant with the design versus, you know, the percentage, the range of percentage you were talking about, right? Like there's a safe range within, you know, 1 or 2%, right? I mean, there are varying degrees of like countertops versus like structural engineering things. So can you speak to who does the double check on that, and just that the language, I guess, is the same? Seems like in the engineering world, the language would be very, very precise, but maybe more back towards some of the design ancillary items, less so. Is that what we're talking about, or?
It could, I might need some help answering this one. So when we talk about the architect's notes of non-conforming, we're also encompassing the architect's subcontractors as well. So that could include engineers or anyone else that's working with the architect to evaluate the quality of construction and its conformance with the specifications. Any other context would that be fair to say?
Yeah, I would say, so John Grumels with Tennessee Builders Alliance, the construction manager on the project. Yeah, if there's an anchor bolt, a structural anchor bolt that's in the wrong location, that's non-conforming, that requires a fix, or we get the engineers to come look at it. Or if I just noticed that wall's got, you know, some damaged work, that's a little different to say, well, it may be non-conforming right now. And some of the issues that the interpretation of work in progress versus completed work that's truly non-compliant is if the wall board there was halfway done but the other half wasn't done, is that non-compliant or is that work in progress?
Okay.
So there was a delineation, and we were saying, hey, it's not complete yet, so it's work in progress. It's not that it's defective work. That would be defective work that requires another. But to your point, structural issues or engineering issues are a little different than a cosmetic issue.
Okay, thank you, appreciate that.
Sure. Any other questions on this issue? Okay. The next two observations are both low risk. The first one is related to payment application documentation. Again, this is not really an issue with the payment application itself, just the documentation included within the package. We identified that certain supporting documents as required by the contract are not always included in the payment application itself. Rather, they are sometimes included at a different date or through a different deliverable. And the timing there is pretty minimal. It's about a 5-day difference maximum. But
Can I stop you just for a minute?
sure.
This whole thing just went.
It's okay,
Is
we're
it
still
fine?
recording.
Okay. Just checking.
That's okay if the camera's off and
It's okay with me, so.
We're still live.
Yeah.
Are we, yeah, that's what I was gonna say, double check, thank you.
Okay. Thanks, sorry.
Oh, right, no worries. Really the issue is that supporting documentation is always included with the payment application, just not always included at the same exact time that the payment application is delivered for review. So that does create some timing differences there. Again, they're very minimal, but there is a difference. And we also noted instances where conditional lien waivers didn't always include all required notarization elements. Again, this is a very low-risk issue, but failing to include all of them can result in reduced transparency and increase the risk of other errors, omissions, or future disputes. So to resolve that, the project management team developed a payment application checklist to make sure that all required elements are included in the package before submission. And I do believe there will continue to be a difference in the timing of when some of those elements are delivered in the payment application, but all parties are aware and have agreed to the timing there.
Questions on that? Nope. Okay.
Okay. The final low-risk observation that we noted is related to reporting associated disadvantaged business enterprise or DBE participation. So we found that delays in receiving payment confirmations from contractors and subcontractors often results in delayed DBE participation reporting. So I want to stress this reporting understates the amount of participation throughout the project. So we did not see any instances where DBE participation was overstated, rather the amount reported and when I say reported, typically through the Metropolitan Sports Authority board meetings or amounts reported to the public are typically understated because those payments cannot be confirmed by the subcontractor. So the risk here is just, participation goals are not being reflected accurately, and there could be a perception that these goals aren't being met when in reality they are, or they're much closer than they might appear. So to resolve that, the project team established enhanced procedures to get those follow-up confirmations from contractors and subcontractors and reinforced those submission deadlines.
Any questions?
Not on this particular bit, what's the timeline or the periods for these audits going forward over the construction process?
You're gonna look at me because we're the one funding them. We had actually planned to start the other one, but we actually ran out of our consulting budget this year. But we've already got it planned to set the next PO, so the next interim audit's about to start. And past that, I guess, depending on the timing of that one. But I'm trying to remember how many were laid out, the initial proposal that we're trying to aim for.
I believe the initial proposal laid out 5 or 6 interim audits. It's likely we'll condense that now. However, we do anticipate an interim audit, a pre-completion audit, and a post-completion audit.
Okay. Well, thank you very much.
Yeah. Thanks, everyone.
Thank you.
You see anybody from Public Works out there?
Well, technically it's waste services now.
No. Sorry.
Well, it's NDOT, it's public.
Relabeled this.
Oh, and well, the audit itself is named Public Works, so.
But was it waste? Which is actually part of our audit.
Well, yes.
We're not different.
Oh, I'll talk to the time. So we can get the team in here.
No.
All right.
Okay, so the next on the agenda is our follow-up audit of public works revenues. So when we initially did this audit, it came out in about 2021, and we looked at revenue collections at public works. And primarily all of our observations related to convenience centers, because that's where the bulk of the cash is coming in when it was public works. Since 2021, public works has become NDOT, or Nashville Department of Transportation, and with that change, convenience centers moved to Metro Water Services, and then later, waste services was broken out of Metro Water Services, so convenience centers have now moved to waste services. But because of that, there was a lot of change in management for convenience centers, which did take a little bit longer to get some of these recommendations implemented, but all three departments were dedicated to making sure the recommendations were implemented. It just took a little bit longer. So with that, our initial audit looked at those cash handling procedures. And what we found, we had 11 recommendations. All of these recommendations were your typical cash controls. So making sure there's segregation of duties, potentially looking into utilizing credit cards more so you limit the cash and limit some of that risk, surveillance, cameras, or transportation and making sure that there's handoffs and transfer, or when you're transferring custody of controls. So of those 11 recommendations, all of them were reported initially to us to being implemented. So we had Mary Cole, our senior auditor, go out and do the follow-up audit. And what we found was that 8 of them were fully implemented. The risks were addressed. A lot of work had been done to make sure of that. And so we closed like 8 of them. We did have 3 of them that were partially implemented, which means that work was being done to address some of the risk, but we still saw a need for additional work to happen to fully address the risk identified. Those 3 included, 2 of them are related. They relate to the cash drawers that are at the convenience centers and making sure that there are till sheets that accurately reflect how much money is in those cash drawers, if it's changing hands during the middle of the day, if somebody is coming in during a break. And most of those controls are to really protect your employees. That way, if something goes missing, then we have a train of who has handled the cash and we can kind of identify when it went missing. And so what we found was there was a till sheet being used, however, it was not comprehensive. And so we found some errors within it and then also some ambiguity on who was handling the drawers and how much money was starting, because there are change funds to begin with. And since then, since the audit report has come out, I will note that Jessie Dillard at Waste Services, who couldn't be here today, she's worked very hard to make sure that we have a comprehensive till sheet. She's worked with us to make sure that the risk is addressed. It was implemented and trained for the staff out at the convenience centers last week, but that means we can't verify that it's been implemented yet. But we will give it time to operate and then go back out there and see if it's fully implemented and then mark it as closed. So those are the first 2, yes.
Oh, do you want us to ask questions on those particular ones or let you go all the way through
Whichever
and
you
come
would
back?
like. You can go on and ask questions.
Chair, what would you prefer? Interject questions at?
I would say,
Mr.
yeah,
Chair?
as of each
Okay.
recommendation, rather than wait till the end, or we'll just get.
I guess if I may, I know whether we're talking about Parks Department, golf courses, or any place where Metro has cash, that's high risk. Things like till sheets, cash, I mean, are there software applications now? I mean, when you say a till sheet, do you literally mean that there's a piece of paper that people, and sometimes I'm just wondering, like, isn't there an app for that? Like, you know, like, I wonder.
There probably is, but when you're trying to get somebody to electronically sign off, or not, when trying to get sign-offs and stuff like that, especially when it's on the job and you're in a little booth out at a convenience center, it's
Okay.
much easier to have that sheet of paper and have somebody sign it.
Okay.
And document the information by hand.
Yeah.
Those are then scanned in, and so we have them in electronic format.
Okay.
There probably is, but it'd probably be more costly than just the written
Yeah,
annual
well,
document.
sometimes I just wonder, a government of metro scale, like, is there a enterprise solution for cash management that we could just apply across all our departments?
Probably.
Yeah, and I certainly respect and appreciate if you're in a little height or whatever, like, we don't wanna like complicate things, but, you know, I think that balance between, you know, if you asked this question 5-10 years ago, it was like, there's this massive system, and people are like, no, paper, thank you. But it feels like we keep moving further down the line of actually, like, literally there is an app for that, right? And if you are an employee and you have your Metro, like, there's.
That's a great comment. It's something that we'll actually, I mean, I'll look into it and see what else is
Yeah.
out there. Because as you said, large scale entity, we should probably be
Yeah.
able to.
I think that would be my ask, again, sort of like backing up the chain a little bit, right? So internal to that department, they're doing a great job implementing this, doing the best that they can. But sometimes I want to make sure that we're like backing up from Metro perspective and saying, okay, you know, matter cured for now, but is there something that we could implement at the Metro level that the next time we do a turn on updating this, that we're using something like that? Okay, thank you.
Okay. Any other questions on that?
Not on that one, nope.
Okay. The next recommendation that was partially implemented related to the transfer from the actual convenience center to the person that was going to deposit the funding. Our initial recommendation was to utilize an armored car service. That's the most secure method, or to at least consider it. Cost benefit analysis for how many locations there are and the cost, it just wasn't feasible. However, Waste Services has worked hard to ensure that there is a process now that is secure and safe for individuals involved to transport the money from the convenience center to the deposit or to the bank. However, there is once again another area where we would want to make sure that somebody is acknowledging this is what I am handing over to you, and somebody else is acknowledging that I am taking this money and I'm taking it to the bank. It's just that accountability of whoever's taking the funding or the money. This was one that when this report came out, Waste Services was very prompt to address it. It was an easy fix. It was basically just implementing a way for them to sign off and say, what time the person came, it's been done. Because enough time has passed, we were able to randomly select some of the days that have happened since their implementation, and so this one we can't say is fully implemented. And that is it for that one, unless there's questions. But we also appreciate Waste Services, y'all coming out to answer questions.
Okay.
Y'all get to go now.
Thank you all very much for being here.
Thank you, guys.
We've got the first school item.
All right. Guess we'll
Schools,
send in
if you'll get
the
Paul.
GPS
Which
crew.
one is the first one?
This is the investigation of the construction.
Construction, okay.
Yes.
Construction.
We've got seats for it.
Sit on the floor.
All right, so our next report is the investigation into allegation around the MMPS Superintendent's office renovations. We received a phone call allegation of wasteful spending related to construction of a bathroom within the superintendent's office. With that allegation, we sent out our investigative team, Paul Guggenellis and Kaylee Harris, to investigate the allegation. What they did was they interviewed key individuals within the process, including the executive director of facilities and construction management, construction, can't remember, as well as looked at the process for this renovation from start to finish. And what we found was This renovation was initially requested in the capital spending plan for MMPS back in FY22. It was a bigger scale. It was to renovate the entire executive suite to be a more collaborative environment. It was not ever completed or not ever done due to funding. However, in FY25, it was included in the capital spending plan again on a much smaller scale. And it was just renovating the superintendent's office to include a bathroom, but to also renovate the shared conference room for the executive suite. Once this was included, because it was a smaller project, it was included in a load of, or a group of funding for smaller projects within the capital spending plan of around like $1.5 million, I believe. It was just within that. It was appropriately reviewed by the MMPS board and appropriately approved by the board. Once that approval happened, that means that it was budgeted for. So MMPS leadership looked into utilizing a contractor or a vendor on file to do the construction project. We looked into how that vendor was procured. That vendor went through the appropriate procurement process. They were on contract already. They were scored. Everything within that RFP process was done appropriately. And so utilization of that vendor was okay. That vendor provided a proposal. It was reviewed internally as well as by the architect selected to review for reasonableness as well as the scope of the work that would be done. The scope of that work included not only the bathroom for the superintendent's office, but also renovating the shared conference room, which did require moving walls and other HVAC units, which would cause the cost to increase. So once that proposal was reviewed and approved by management, that's when the contractor got to work. That contractor had a timeline of 8 weeks. It was completed within 7 weeks. We reviewed all of the supporting documentation submitted. The contractor provided progress photos, detailed invoices of costs. We reviewed the invoices and all the supporting documentation, not just for whether or not it footed, but also to make sure that the costs were reasonable and that they weren't excessive. So items weren't being bought like nicer sinks than would be expected within that type of thing. So you're trying to make sure that it's reasonable cost for these items as well. We found no discrepancies with that. Everything was reasonable, everything footed, and everything seemed to be disclosed. The progress photos along the way were valid, and then eventually getting all the way to the permit to utilize the space. So with that, because the entire process went through the appropriate procedures, both from budgeting all the way through procurement, and because this is a smaller scale project, it was not required to be publicly disclosed. It was included within their capital spending plan, so we did unsubstantiate the allegation. If there's any questions?
Questions from anybody?
Can you talk just a little bit in general about the process for MMPS's capital spending plan? Is that incorporated into a larger metro capital spending plan, or is that?
I'm not completely sure about that. I will actually let him speak to that.
Sure, be glad to. Thanks for the question, and thanks for having us here. I'm Maura Black-Sullivan. I'm the Chief Operating Officer for Metro Nashville Public Schools, and facilities and construction is in my shop. So we do create a capital spending plan, a capital improvement budget, short-term, long-term, midterm. Every year it's approved by our board, and a capital spending plan that is then submitted to the mayor's office and then is approved as part of the entire Metro capital spending plan.
Are there plans to do the rest of the remodel?
Not at this time.
Okay. But it still needs it, so
It
hopefully
does.
at some point
It
will
does.
be able to be included.
It does.
Auditor Riley, if I may, Chair.
Please.
Can you just from a process standpoint for the viewing public, right? We have hotlines, people can call in, and so, any citizen or person, employee of the Metro government can call in to share a concern. Can you just sort of speak to how, you're wanting to make sure that's a credible concern, right? Like, so just because it gets booked into the system or called in, you all are doing maybe another tier of vetting just to see, is this person approximate to this project? How would they have known this or whatever? So it's not that anything and everything that gets called into the metro government will induce this, but likewise, we do want to maintain that ability for citizens. Can you just sort of speak to that call-in process, how this was initiated?
So every allegation that we get is reviewed by our investigative team for predication. And that is where we look at, one, is it within our purview to actually investigate? And two, does it seem credible, and or not even credible, I won't even say that, but is there sufficient, one, information within the allegation that we could even investigate it? A lot of times, sometimes we will get very vague ones, like a department is stealing. Well, that's very, it's very broad. It's specific allegations, and once we have enough that we think, it could go either way, we will then actually launch an investigation into that. But there are some that we do just predicate as this is not within our purview. Most of the ones that we don't look into are because they're not in our purview. We get a lot of theft of personal devices, or somebody sold something on Craigslist and they didn't get the money that they thought they were supposed to get Venmo'd. Those are all referred to the police department or other departments. Every allegation that we get is followed up on. Sometimes it's a management issue. It's something that's either HR or it's management. And in certain cases, if it's HR and we feel like it's something that we don't necessarily want to send to management of the department, we will send it to central HR to look into instead. And so there's different ways that we will get rid of or push them to other departments, but we make sure that they are addressed in some way.
Follow-up question. So, someone doesn't get their money from a Craigslist Facebook market sale. Are you saying that residents of Nashville are calling in because they did not get money, or a resident of Nashville made a purchase from a Metro employee, so they're calling
No,
in?
it is just somebody who tried to sell something to another Metro citizen on Craigslist.
Wow, and they are calling you?
Yes, and so a lot of times those come through Hub Nashville, and what it is they're going out to Hub Nashville and just searching the word fraud or theft, and our form comes up. But we do always make contact and make sure that they understand that we are sending it to the appropriate department.
And then you send it to?
They send it to police department. We've got contact in police for those types of situations. We have contacts in multiple departments, I guess, that we will refer our allegations to if they do not fall under us.
Thank you.
Sounds like that might should go on an FAQ page.
It's one reason
You have a private transaction, do not submit that.
For Hub Nashville, we were very limited on the questions that we could ask, but it's also why we built one through our software that we have that's more detailed, where you have to select much more detailed criteria, so that in the event if it doesn't fall underneath those, then you're directed to, this is not within internal audit's purview.
Yeah, okay.
Thank you.
Thank you.
All right, any other questions for this audit in particular? No? Good. Okay. Stick around.
We do need to go, let's see.
All right.
Opioids is next one, so we will need to ask.
Do we?
Could I ask, does chair have the discretion without objection to
move
pull
the agenda
the other MNPS matter?
We can do that. You can arrange, yes, y'all can move the.
Forward,
Yeah.
just so everybody doesn't
Why don't we
have to-
can we just take care of all the MMPS stuff?
Yes.
I was gonna say, is everybody from the payroll want to hear as well?
I'm here for payroll.
Okay.
But our chief financial officer probably is not here.
Okay. All right. Well, then I will go on and do the payroll audit.
Do you have any other MNPS people that need to be in?
This is everybody.
So we issued the audit of MMPS payroll processes. This audit was done because, as you can imagine, payroll is a large piece of the MMPS budget, and with so many employees within their organization. So we wanted to make sure that those processes were in place to ensure that those employees were paid timely, accurately. And so with that, we looked at 2 full fiscal years worth of transactions, and we looked at 5 different objectives. One of the objectives was just your general, are individuals being paid timely, accurately, are they complete? We also looked at the access to the system to make sure if any changes could be made within the system, whether or not individuals had least permissions, so that you don't have anybody messing with salaries or anything like that, which inappropriately. We also looked at changes in salaries. So how were they processing changes in salaries, whether it was just an annual increase or if there was an adjustment, how was that handled and was it appropriately done? We looked at terminated employees to see if the terminated employees were promptly terminated and their access to systems was terminated, as well as payment of their last check. And last, we looked at physical checks, because some individuals still receive some physical checks during the time period. And we wanted to make sure that since a check is like a cash instrument, that those are secured and properly handled. Overall, we found that there's a lot of great processes in place. Individuals primarily were being paid accurately, timely. We didn't find any issues with access as far as having too many permissions or anything like that. We surveyed a bunch of the timekeepers at the individual schools, and they all spoke very highly about the training they received and their understanding of how to process payroll. We did, however, have 3 observations. They were all medium risk. The first observation related to documentation. We looked at hourly employees, which should have as their document of record a timesheet that supports their payment. Many of the sample selections that we had, we could not get timesheets for those specific pay periods that we selected. Timesheets are very important to hold on to, as some required by law, and we want to make sure that those timesheets and that documentation is retained. Additionally, some of them weren't signed appropriately by administration, and we found a few small discrepancies that we were told reasons for the discrepancies, but not necessarily that it was documented, and so we want to make sure that all that's documented. So with that, we recommend that documentation for all employees be kept to support the pay that they are receiving. This one is actually already implemented because back in November, December, MMPS migrated over to Oracle Time and Labor, just like Metro Nashville did. The general government did. And with that, those timesheets are now electronic, as well as the approval flows for all of those as well. And they're being paid from those electronic timesheets. So this one has already been addressed. We can't necessarily say it's verified. We haven't gone out and done it, but it has been implemented or reported as implemented. The next observation we had related to terminated employees. We looked at a sample of terminated employees and found that a number of them, the access was cut off later than it should have been. Just making sure that the access is removed is just one more level of IT security, as well as noting that some of them were paid before their last day and some of them were paid well after the standard set of 21 days. They were paid after that. There were going to be some with the operations of schools as it is. What we found was there's so many different schools that sometimes it's a communication issue and communicating that up. This is another one that schools has reported as being implemented already, and the fact that standardized processes and training and making sure that when that termination date is included, it's automatically cutting off their access the very next day. And so that's already been implemented. There's standard processes and training on that. Our last observation related to physical checks. What we did for this one is we went out to some of the individual schools and talked to the individuals who worked there and said, hey, let's see what are you doing with your physical checks? What we found is the great thing is they're all being locked up. Who has access, whether it's to a safe or a locked drawer, is limited. That's the first level of security. However, past that, every school that we talked to may have been doing something different. There just wasn't a standard procedure as far as when those physical checks were being handed out, somebody signing for them and making sure that it was documented that they received that check. Since then, so because of that, we would recommend that standard procedures be implemented and that there is some sort of log, electronic even, that is showing when individuals are picking up their checks and signing off that that's happening. This is one that's in process, but schools is working to do just that, make more standard procedures and train the actual individual schools on how to handle those physical checks. Those are getting less and less, I will note that. There are fewer and fewer physical checks as we become more electronic, but there are still physical checks. With that, we appreciate the cooperation and help from Metro Nashville Public Schools throughout this entire audit. We also appreciate Nan Wynn, who was the senior on this audit, who unfortunately couldn't be here today. But if there's any questions, we're happy to answer them.
Everybody, go ahead. Just one on observation A about the timesheets. It says that 34 employees were paid 1 hour more than what was reported on their timesheet. Does that mean they were paid the correct amount and it was underreported on their timesheet, or they were paid more than they should have been?
That is a great question. I'm not completely sure. However, they had the exception, so y'all actually may be able to answer that.
Potentially. I'm Lisa Spencer. I'm the Chief of HR for Metro Nashville Public Schools. Thank you for the question. It is entirely possible that the timekeeper miscoded, miscalculated, whatever, and someone in my office recalculated and then paid them correctly. Because we will always try to make sure the employee gets everything that they are supposed to get. So we do recalculate those timesheets.
And the transition to Oracle has taken care of that issue?
Helped a lot, yes.
Thank you.
Thanks. My question was on observation B with the terminated employees and their access to Kronos after being terminated. You mentioned that there was training. Was there training for like HR professionals? Was it with central office and then it kind of trickled down, or who exactly got the training?
So in terms of terminated employees, the issue really is communication with 131 schools. And so we implemented in 2023 a new reporting system for reporting a separating employee. And principals are supposed to tell us immediately when someone separates. They're also supposed to validate their payroll roster every 2 weeks to let us know for sure. And so that training was really around, this is how you tell us that an employee is separating from the district, what the date is, et cetera, et cetera.
Okay, so then I'm assuming as new principals like enter into the pipeline, then that's part of the training.
It's part of their training as well.
Thank you.
Just a follow-up question on that really quick. Was that also a system that was replaced under the new Oracle?
No, sir, that's actually, we're using our IT ticketing system.
Okay.
It's called Services for You, and we built a specific ticket inside Services for You called our end employment log. And our principals simply go in and they put in a ticket for a separating employee.
Gotcha.
And so we have a full log. From the day we implemented that system to today, I can tell you everyone who's been entered as having terminated.
But it's separate from your Oracle workforce system?
Yes.
Okay.
There's not a mechanism within the Oracle system to report that someone is separating from the district.
Really? Interesting.
If I may, Chair.
Please.
How many employees do you have, salaried, hourly? How many are getting checks? I mean, are we talking about 100 people in a massive system, or what is kind of the?
Yes, ma'am, thank you. We have roughly 12,000 employees. About 3,500 of them are non-exempt hourly employees. The remainder are salaried employees. Since we have moved with Metro Nashville to payment cards and really enforcing the direct deposit requirement, in general, the only people getting a paper check will be brand new employees whose direct deposit is not yet set up in the system.
So it's almost just a temporary mechanism.
And it's rounding at about 250 a pay period right now, down from well over 1,500 when you started that audit in 2022.
Interesting, okay. And is there anyone within that 250 per pay period who is just like, I want a check, give me a physical check? Like, it's just, is that even a thing that we?
Some of our retirees who act as substitutes.
Okay, a few retirees then, okay, got it. Yep.
Yeah, the payment card didn't do it for them.
Understood, I get that, yeah.
Yeah, they want paper.
All right.
Anybody else? Good. All right, thank you. Okay, moving on to the discussion to amend the annual audit work plan to include a performance audit of Metro Nashville Public Schools. Lauren?
Okay, so during the FY '27 budgetary process, there was a request made by Councilmember Spain to adjust the substitute or the mayor's budget to include $800,000 for a full performance audit of Metro Nashville Public Schools. We have done one of these before. It was RFP'd in 2013, work was done in 2014, and then was issued in 2015. It's a 600-plus page audit, and it covered 12 different areas of schools' operations. We're happy, it's within our purview to do that as well. So since this was requested, we cannot do work on it or do any type of movement on it unless it's on the audit plan.
Okay. Yes, ma'am.
I guess I have some just kind of process and scoping questions. And so I would want to understand the various kind of, thresholds along the way. What does it mean when we add it to the audit plan? In so doing, must it be fully scoped, or can we add it to the audit plan per, the vote that's been made and we know it's going to happen, and then kind of hold space, so to speak, whether through a specific motion here, to say, we would like a proposal for that scope, for the audit department to come back to us at our next meeting to set that scope. And so I just wanted to kind of speak through it from a process standpoint, whether that be a look back of the last performance audit, and just sort of speak into that a little bit.
So for scope, one, this was requested as a full performance audit, a comprehensive audit of Metro Nashville Public Schools. When we scope an audit, we do it after the planning process. So we go through the entire process of interviewing stakeholders, learning about the different processes and the different areas within an audit topic. And then at the end is when we scope it, because you're trying to identify where the risks lie. Now, if we can't really set the scope for this audit, what I would recommend is what we would do is we would utilize a consultant, and that consultant we would hope would have, or we would need them to have, subject matter expertise within K through 12 operations. And so the way we would foresee this happening is that consultant is going to have a proposal, and that proposal is going to include the different areas that they potentially could look in. We would assume that we would hope, or we would request that there would be some cost associated with that. But what they would likely do is take into consideration just their subject matter expertise. They would look at the 2014 audit, and then also look at other audits across all of the U.S. To see what those are. See if there's areas, emerging risks that maybe potentially need to be included. And so with that, I will say that if you're going to put it on the audit plan, I would say to add to the audit plan a comprehensive audit of Metro Nashville Public Schools. And then from there, the discussion that I would propose is discussing how you would want the consultant, or how we would want to acquire the consultant. I've done research since I spoke to the budget, at the budget work group, and had hoped that there would be more actual experts within just K through 12. But what I have found through my research is, the one that we did in 2014 was done by a general audit firm. We did not have any consultants on contract, and so we did have to do a full RFP process, which is a lengthy process. However, what you find now is that there are larger auditing and consulting firms, and what they have is almost just an arm that's dedicated to specific industries, and so they have arms that are K through 12, and those types of school audits. So with that, and knowing that, I did reach out to our consultants that we have on contract. We have 4 auditing firms on contract. All 4 of them are national firms, some of them are international firms as well, and asked them if they have this type of, if they do this kind of work. One of them bowed out immediately and said, we probably could do it, but that's not our bread and butter, which I appreciate the transparency. The other 3, one submitted a proposal and gave 3 references of audit school districts that they've done work in. Another, the current partner on that, our audit contract, is actually the former audit partner who did the Metro Nashville Public Schools audit, financial audit, as well as that firm does have an arm that's industry specific to schools, and they would leverage that subject matter expert. And the third had basically the same thing. They provided with 3 different, I believe it was 3 references for school districts where they have performed similar work. So we can go the route of utilizing one of our current consultants. If we went that route, what we would do is similar to what we did for the Titans Stadium or the new Nissan Stadium construction audit. We had a mini RFP. We had them all present proposals to us, looking at taking into consideration subject matter expertise, providing us those references so we can look at those references, and looking at their timelines, their proposed budget. We have all of those contractor rates locked in. We wouldn't have to go through the full contracting process. So what I would recommend is if we did one of those and we selected one of those consultants, then we would begin working with them. Similar to, I'm trying to remember which audit it was, where we had a lengthy discussion about the scope of the audit. We can't provide the scope of the audit to the audit committee because that happens in the middle of planning. Our audits that are draft reports are confidential from start to finish until the audit report comes out. So if we discuss that scope in an audit, in a meeting, we could come to you and tell you what the scope is, but in order for us to remain independent, we would work with the consultant directly to establish that scope. But like I said, they would take into consideration interviews with council members, interviews with school board members, to see where areas are that are of concern. So that would be my recommended approach to it. I'm not sure which way you want to go as far as RFP and stuff like that. But all of those items would be taken into consideration. As far as the effect on our audit plan, it really would not affect our audit plan. We do have an audit on our audit plan of Metro Nashville Public Schools harassment, discrimination, and retaliation complaints. We would remove that. We could remove it or we can leave it on there. It's one that we do eventually want to do with this audit plan. However, it's not something that we would do in tandem at the same time as a full comprehensive audit.
And so, just to clarify on that last point, if I may, so that audit is, it is in draft report status at present?
For the harassment, discrimination, no, that's the general government one. The one that's at the top is general government. So we had that one. That one's broken into 3 audits.
Okay, sorry. Okay.
It's low. It's on this lower half of the Metro Nashville.
18.
I'm sorry. Okay,
Yes.
got it. Okay. All right.
Because we're doing, I was gonna say, we're doing 3 different phases.
Got it. Okay, that is helpful context. Yep.
Thank you. I have 3 questions. I'll start with the last question. Is there any con to doing it the way that you just recommended, or is there any benefit to? That sounds like a better way than like putting out a full like RFP. But is there any benefit to putting out a full RFP, and is there any downside to doing it the way that you just recommended?
As far as the benefit of putting out a full RFP, I mean, other than just giving more opportunities, since when we did the initial RFP for our consulting contracts, we're generalist, it's general audit services. There are potentially smaller firms that do more, that have more of a school focus that may have wanted to bid on it, but they didn't because we were general when we put out that one. That would be the only con or pro, I guess, to doing a full RFP is you might pick up some of those. The downside to not using the consulting contracts we have right now is that it is going to be a lengthier timeline. The RFP process is a lengthy process. We would go through it and we would do the scoring and everything, but the posting of that and getting through the RFP process would be the main con to doing a full RFP and not utilizing the contracts that we have.
Okay, thank you. And then if we do the mini RFP process to work with one of the 3 entities that we already have an established contract with, will that take away from like their capacity to do any other audits that we may be working with them on?
It shouldn't. All of our consultants are very large firms, one of them being the 6th largest in the U.S. But they're very large firms, especially if they're using, usually the teams that we work with, once again, are general audit services. So we probably will not take away from our audit teams. Y'all saw Baker Tilly present. We can still utilize them for consulting work, even though they have the interim audits that they're doing. We still have a team that we can work with. So it should not take away from that.
Okay, thank you. And then my last question was, there had been some conversation about like possibly a joint committee between like school board members and council members to try to help define maybe like the scope of the work of the audit. But if I'm understanding what you're saying correctly, in order to maintain independence, we would not be able to go that route However, they would be able to interview both council members as well as school board members independently to help craft the scope of the project.
That's correct. Government auditing standards, which we follow, basically says that our office has to set scope of the audits. But like I said, like you just said as well, we try to take input. Stakeholders and process owners are a wealth of information, and many of them will be forthcoming on areas that, hey, maybe they have concerns about or they have interest in. So it's important to talk to them, but at the end of the day, we have to set scope or else we are no longer independent.
Thank you.
Good.
So process-wise, we need to take action to amend the audit plan. Does that action need to reflect a decision on this, on who's going to conduct the audit, or is that a subsequent conversation?
It does not. It can be a subsequent conversation. The discussion around it could be done at a special meeting if you wanted to continue moving forward with this, or September is our next meeting, is our next regular meeting, so if it was pushed off, it would be 3 months away. But the discussion and the decision around who does it, it can be delegated to me, or the decision can be made today whether or not to do a full RFP, or wait, whichever. So those are two different decisions.
Go ahead.
How much time would you need to evaluate and set interviews for potential outside audit firms?
Well, if we use our current consulting contracts, I've already contacted them, and like I said, one of them already provided a proposal. And then the other two, just quick responses. Usually when we do like mini RFPs, it takes like a week. We give them about a week.
Well, I'm just thinking, given what we just learned, that we're sort of talking about two separate issues, and just by way of context, I started this conversation around the beginning of this year when Lauren and staff were formulating the audit plan, and I brought this idea up at that point, and she said, yes, we could do it, but it's outside the scope of our office to do internally. We would have to use a consultant, and that would be outside of our normal consulting budget. So that's how this wound up in a request for inclusion in the FY27 budget, and that's how we wound up having this conversation. And it really just sort of grew from the fact that we haven't done one of these since 2014 in that time, and I apologize to those of you who've heard this spiel before, but in that time our enrollment has fallen slightly from around 86,000 students to about 81,000, and the budget has essentially doubled from $750 million to approaching $1.5 billion. And it just seems like a glaring hole in our ability to have responsible oversight of taxpayer dollars on an area that is year after year our single largest investment and represents over a third of Metro's budget. So that's where it's sort of the genesis of the request. And given that, and that the council approved the funding for the audit, I will move to amend the audit plan to include comprehensive operational and performance audit of MNPS.
There's a motion then. Does anybody have a second to that motion?
Can we amend the motion before it's seconded? Or do you want to let it die and then, because I think we need to discuss.
More
May I ask the motion maker just a question before I second it?
You can change your motion before it's been seconded.
Okay.
Okay. I guess my question to Mr. Spain would be, would you intend subsequent to this, or Chair, could we then next take up the issue separately of mini RFP, public RFP? So do we want to just sort of take these sort of step by step? So if we acknowledge we funded whatever, so we're not necessarily getting into the specifics with this motion, we're just basically fulfilling the budgeted funding and getting the process started with this motion. Is that correct?
That was my intent, was just to take the next step in the process and then continue the conversation we're having about exactly what the process looks like.
I think it's a question maybe a little bit for Ann about whether that subsequent motion and vote on the process of the RFP would be included in the agenda item that we have before us, right?
I think, just given your discussion, I think it makes sense to make them two separate motions.
Okay. Okay.
I'll second the motion.
Okay. Second. Any discussion?
I was pretty adamantly against the audit initially when this kind of first came up in the wish list conversation. I talk about it all the time. Former MNPS employee, MNPS parent. My kid just graduated from there. Former MNEA member, super supportive of public schools. And the more that the conversation evolved, the more that I heard from constituents and listening to conversations through like our budget work sessions, even in conversations with like school board members, like the more that I kind of like thought through it and hashed it out internally, I think that it is a good thing because I am very certain that our school board and the MNPS, I am of the belief that they are doing things the right way and that this audit is going to show the highest and best use of the tax dollars that we allocate to them. I think that overwhelmingly the council supported this when we went through the budget process. I believe it is the will of our council to want to, there was funding allocated for this, there was some funding allocated for this. So I know that this is something that the council members are supportive of. We hear, on both sides from constituents, people that are super supportive of our public school system, and then some people who just, may not have correct information, and sometimes people have like wrong assumptions. And I think that a process like this will be able to really highlight the things that are happening with our school system, which I trust will be good things. So I'm going to be in support, but I wanted to kind of frame my support.
Sure, thank you.
And I would just say something similar. I think, for any department of metro government of a particular size, if we look at the audit plan historically and the cadence that we are on, a decade-ish, I think is worthwhile. But I do want to be sure that I articulate that my support of this is not sort of predicated on my belief that there is a problem or to be found. I just think that to Ms. Porterfield's point, that in a comprehensive space where we know that it is best practice for, however, in our subsequent vote, we determine the contracted person will be reaching out to the school board, the staff of MNPS, the subject matter experts. And my hope would be those things that, elected officials who represent schools that we respect very much and staff as well, that they can, through that process, elevate, this is one thing that we would like to look at or understand better, or we think maybe has some potential risk, right? That it is in that way because you have your, feedback into the process that is separate from us, rightly and scoped there. That with that, I can support this and we'll be voting yes. Yeah.
I would just say, in preparation for this, I pulled down the last Metro audit from 2014 to take a look at kind of what was in it. And the thing that struck me most about it, I think, was that about 85% of the findings in that audit were accepted and changed by MNPS, which I thought was an interesting kind of number. So to me, this is about evolution and discovering things that we might, take a second look at and be able to revise moving forward. It's definitely not an indictment on our schools or the job that you are doing. Similarly, my wife was a teacher for 20 years, so I definitely have a soft spot for that. Given that, anybody else have any discussion? All right, all in favor? Aye. Opposed? No? Okay. So the second part then is some discussion I think that we need to have around how we want to go about interviewing folks. Anybody have any thoughts there?
Chair, if I may, maybe just to follow up on Ms. Porterfield's question when she kind of pro-conned, the mini RFP approach and what Auditor Riley has said about some of the larger firms that have an arm or subject matter expertise within their larger, competencies. I guess what I just want to make sure of, and I know certainly, we can't sort of cherry pick and say, hey, but, that schools would want this audit individual, but I would imagine you alluded to, there are some smaller firms who might have a very sort of intensive expertise in this space. And so I would just want to make sure that in proceeding from an efficiency standpoint with maybe a mini RFP where I am inclined, that we are not sort of taking off the table, if we were to do something for a school system of our size, that there's not, one or two out there in the United States that people see as just sort of the preeminent best to do this kind of a firm. So can you speak to that maybe just a little bit more?
I tried to research it. Admittedly, you get variable responses, depending on how you Google it. And trying to find a comprehensive audit of a school district, especially MMPS's size, is almost impossible. They're not done often. And so what you tend to find is smaller school districts, a lot of the state audits, departments will have them done for certain school districts within there. And so a lot of times you see them either done by the state or there are some firms that have done those. However, like I said, with the last one, when you start to look into them more, they are more general. So determining whether or not that's their expertise would be difficult. I can continue to do more research. But from my cursory review, it was hard to find smaller firms in which that was really that they were pushing is what they were doing. However, I can reach out to other school districts. I'm sure that MMPS could also give me comparable type school districts that may be beneficial to reach out to see if they have ever encountered this or if they have any or performance audits or anything like that, that they would, they have consultants that they would recommend.
I have a kind of follow-up and a couple of questions based on that. With the understanding of the answer that you just gave, if you did like just a full-out RFP process, I know you said that process takes longer, about how long could that process potentially take?
It's a good question. I wish our finance director was here because the last RFP that we did for our consultants that are on contract, it took about 6 months. But that's because there is such a backlog of RFPs that have to be done within the metropolitan government. I don't know if there is a fast track or anything like that, so I wouldn't put it out there that we could do it. But for our purposes, the last one that we did took about 6 months from start to finish.
For just the RFP process prior to anything else happening? Okay. And then you mentioned that this is something that is not done often in your research. Just for our like situational awareness about how often are they done, because I think that's important to like frame the context. Like, is every 10 years like too often or not often enough?
No, and it's kind of looking at context of how much has changed. And so I don't know that there is a regular cadence as far as doing full performance audit of a school district. The ones that I found that were done by the state, I think they actually try to rotate through. However, they're not like the state of Tennessee where there's 95 counties and all these different school systems. So finding an actual cadence would be difficult. But if you look at the changes, as Councilmember Spain has mentioned, over the 10-year period, there is sufficient change that you would think that that would be room enough to do another one. If it was the same, almost everything since then we probably could be, if we weren't a growing population and a growing city with more different students. You pointed out that they're going down. But with changes that have been made, it would be beneficial to do one. But I can't give you an exact number on when that cadence would be.
Okay, thank you. And then my last, I guess, just comment is when you initially said like smaller firms, like my ears perked up because what I'm hearing is that may make it like more equitable. I know sometimes like smaller entities have a hard time like bidding on like these big projects. So like a smaller firm may not have been able to bid on being like one of our consultants that are just kind of in the rotation, but they may be able to be a part of like something like this. But in hearing that could delay things like 6 months, my preference would be to go to do the mini RFP process and then maybe have them to come back and present to us and then we have a conversation. But I would love to hear other people's thoughts on the process.
Just following up on that, you mentioned that if we do the mini RFP, they would come in and present to us. By us, did you mean you and the staff or to the committee?
Normally it's to us. Y'all can, I mean, we, like I said, we can do a special meeting where we could have them come and discuss. And you all can make the decision. We've made, like I said, we made it for the Nissan Stadium one, but that was because that was an independent, it's a much smaller project. And so that's why we did it for us. I said, when I say us, I meant us, but at the same time, we can do it either way.
And if we go through that process either way, if you or the group or whatever is not blown away by the options before us, then we would still have the option to do a full RFP at that point.
That's okay.
And it would be a public meeting, so members of the public could come, they can stream, they could all watch, so it'd be a really transparent process of what those proposals look like.
Yes.
In that kind of formulation, what opportunity would we have to give you input about what would be important to us in selecting an audit tool?
You can send me emails to just me. You cannot include each other, correct? You can have input. Looking at, what I would recommend is looking at the last MNPS audit that we did, those 12 areas, and keep them, it's very general in that kind of area. But we can make sure that if we are gonna get a mini RFP for our proposals from our consultants, that they would potentially price out like the work that would be done in order to address specific areas, whether it be transportation, nutrition, or other programs.
So I think, I'm inclined to do the mini RFP approach, but I'm still thinking on sort of the, objectivity of professional staff making that choice balanced against transparency, public awareness of how we're engaging this process. And so like the kind of objectivity of, professionals outside of the public sphere just making objectively what they think is the best choice really appeals to me. I anticipate that might be not a difficult conversation, but I would say just kind of historically, I don't recall in my time of service, and I may not be recalling correctly, but if you had engaged or initiated the mini RFP process, is there any precedent for you then bringing those proposals here? And when you do so, are we simply having a discussion to convey our questions and feedback to you, or are we voting on it? Because that seems odd. I'm not saying it's inappropriate, but I just want to understand it from your perspective.
It's a good point, because what makes us independent is that we operate independently, that certain things are delegated down to us. There could be a perception, depending on the consultant that is chosen, on whether or not there is bias amongst the committee to make those decisions. So understandably, to your point, it is balancing that transparency. We've never had the audit committee select the individual to do an audit before. That's always been delegated down to us. And the last one was done by an RFP, Seth, do you remember? An RFP process, and the people on the panel for the RFP process were within Metro Internal Audit. Yes. And they did not include any of the audit committee members.
I mean, I think I lean to that a little bit, but just by way of follow-up, but go ahead.
I get that. I think that is a very fair and balanced approach, and I think we should leave the job of the experts to the experts. And I also think that we will bring a certain purview and lens, not that y'all don't have that purview and lens, but there are certain things that for example, I would want to know that the person or the entity that is coming before us is going to be looking at through things through an equity lens, and that will be, making considerations for the demographics of our students and how many of our students are English language learners, and how many of our students have disabilities, and how that has an impact on performance, and how many of our students come from a lower socioeconomic status, and just making sure that they are comparing all of the things, and that how much of our school budget goes to like vouchers and goes to entities that MNPS has no oversight over. So I wonder if there is a compromise somewhere of maybe there is a recommendation that you all are making that maybe we don't know about that recommendation yet, and maybe that is like, we get this RFP process, the mini RFP process, we see the RFPs from the groups, there's a conversation about like maybe where we're leaning, and then we can kind of juxtapose that to where you all are leaning, and maybe a decision could be made that way. I don't know if that then makes it not, I don't know if that takes the independence away from it, if we are opining on the direction that it goes in, but I think I would appreciate the ability to at least see those.
If what you're asking for, let me just ask this possible, is for them to do the mini RFP process, for us to be able to view those applications and then provide some feedback back to the staff prior to them making the decision, or are you wanting to still make the decision at the or
I would love if we could at least provide feedback.
I think I share the Vice Mayor's concern that level of input from this group could at least give the impression that we're trying to prejudge the outcome, which would completely defeat the purpose of an independent audit like this. And if I understood you correctly, and I would assume it to be true, that no matter who is selected, one of the first things they will do is to meet with MNPS leadership and board and council members and whomever for conversations like that to find out what is important to us and what, where we want to see this thing go. Is that fair?
Yes, and also to your point about the equity lens, and to chairs, or vice chairs, perspective on having input, you could send that input and we can make sure that that's part of our request when we're asking for these mini RFPs, and the delegated ideas of us still evaluating that and evaluating those responses to it. That would be leading to our decision as well, knowing that that is important to you, or knowing if there's other areas that are important to be considered within this, we could ensure that those are taken into consideration. I'll also point out that if a full RFP was being done, much like the last one, the audit committee would not be on the panel for that as well. And it would be an evaluation that would be done at the audit, within the Office of Internal Audit.
And I just want to note, sorry.
Please, go ahead.
Just sort of looking at like the code and the charter regarding the respective duties of the auditor versus the committee. It's the auditor who shall conduct or cause to be conducted financial performance and other audit services. And the audit committee, in contrast, your duties are to oversee the annual audit plan and review and evaluate at least annually the performance of the Metropolitan Auditor. So for what it's worth, I see your duties as being sort of like a broader overview and oversight of the plan, and the auditor is the one who is conducting the audits.
So in that case, I don't know that we need another vote. I mean, we've approved to add it to the audit plan. I think that's kind of, given what you just said, where our involvement kind of stops here.
Do we need a vote on the mini RFP
I don't think so.
versus the full RFP, or we've checked that?
I wouldn't think so. It's more guidance, I would think, than, and then I'll also point out that when this isn't a draft, it's a draft audit, it can be discussed within our executive session. So if there are checkpoints that you all would like to have, where we have those discussions in executive session, so that at least along the way, you're aware. You would not be guiding anything, you would not be making any decisions since it's executive session, but more as a touch point to say, here's the progress of the audit.
I think from my perspective, I just want to make sure that, that there is not a perception, while I appreciate, that the auditor is always, thoughtful around requesting, feedback or input, and we certainly want, subject matter experts to be giving, information that would inform your process and your selection. I am a little wary somewhat of just sort of the all call for, feedback somewhat because you know, schools are, there are elected officials who represent schools and they have their board and, in our capacity as the committee, the council, what's funded. And so from a, I guess, collegiality perspective and just objectivity and transparency, I just want to make sure that there's no perception that, we're sending emails to the audit, make sure this thing is in there and make sure that thing is there and look at this and look at that. I think within, the routine, appropriate process where within your authority and professionalism, you determine that you need to reach out to people in finance at Metro schools or, follow up. But, on our sort of more respectfully, like political side of the house, like I want to make sure that we're, meaning the council, and we've talked about that before, this is a very small committee of which, 5, of which 3 are elected officials, right? And so I'm always very mindful that there's never any perception of politicization of what we're doing. I'm not saying, we can't email the auditor with suggestions, but I would want to make sure that there was, fairness expected, that, you would likewise solicit the, the suggestions or input of MNPS and the elected officials that represent them, so.
Thanks. And just to be clear, my suggestion wasn't about what should be audited. My suggestion is making sure that
Yes, the
whoever is
selection.
chosen
Yeah, I
is someone
appreciate
that is going to be as equitable as possible with a good understanding of like a school district this size and the demographics of our school district. Like, I wouldn't want them to get dinged for something unfairly. So I just want to make sure that we are. Yeah, so that was my intent of my comment.
So Vice Chair, did I hear you say you don't think we need
I
to
don't
vote
think
on
we need
any
another-
RFP versus
no,
RFP?
yeah.
Okay.
All right. Thank you.
Thank you all.
Health Department finally gets to come in.
Councilmember Evans and Health Department. Yes, in retrospect, we might should have pulled the Health Department opioid
Right.
forward and then done schools in sequence of periods. Sorry. Yeah, next time. Yeah.
Next time.
I know that, I guess for the general public, these are in dated order.
Yes,
Like
with the
as-
exception of, I did move
with-
the
with-
Nissan Stadium first, but only because I knew they were bringing about 20 people.
Yes.
So we were trying to get the consultants who we pay hourly out.
Balancing a lot of factors, yeah.
It's
Welcome.
finally y'all's turn.
Yeah. School's pulled the fast one.
Blame schools.
Trying to be efficient. I hear all the same people, they want to be coming in and out.
Yes, schools is done.
That's what I
Yes,
thought.
sorry, all of schools is done.
Try to listen on the phone. Nothing wrong.
Okie dokie.
Seth?
Lauren? Oh, Seth.
Seth?
Good afternoon. Seth Hatfield, I was the principal auditor, or quality assurance auditor on the opioid settlement funds audit. We have Mary Cole here. She was the senior auditor that did all the work. I appreciate the work she did. We have the health department, Dr. Shamni Ariola here. We appreciate your assistance during this audit as well. Our audit scope for this audit, it was March 1st, 2022 through end of May 2025. And that's a longer scope than we typically have, and we just began it when Metro Nashville was first notified that, these settlement funds were going to be coming in. So we wanted to make sure if there's any planning or anything that was discussed before the funds were received, we wanted to include that in the audit period. We had 3 objectives. One objective focused on compliance, the other implementation of the program, and then finally an objective around performance and oversight. The first objective was our compliance piece, just to ensure that opioid settlement funds were in line with allowable uses. We reviewed, so some of the testing we did under this objective, we reviewed reporting to the Tennessee State Opioid Abatement Council. We looked at grant reporting for the competitive grant that was received from the Opioid Abatement Council. Ensured that there was completeness of all the received funds that were received during the audit period. Looked at contractor invoices, expenditures, and also payroll for individuals that were paid with settlement funds. And part of this is what we evaluated against. We evaluated the expenditures against allowable opioid remediation uses established in the National Settlement Agreement. Those are incorporated into Tennessee State Subdivision Opioid Abatement Agreement. And those just broadly describe the allowable uses that define how settlements funds may be spent. We did note some control weaknesses around payroll documentation, invoice review, some reporting accuracy. And then we did have a scope limitation for this objective over payroll allocations due to management, or the program manager directed employee responses. And I'll go into that a little bit further when I get down to the observations. The second objective was to determine if settlement funds were expended in accordance with the Metro Nashville Opioid Steering Committee. So in 2022, the Behavioral Health and Wellness Advisory Council was tasked to develop recommendations for the use of the incoming opioid settlement funds. Subsequently, there was an opioid steering committee of community stakeholders, which developed the proposal that served as a framework for the opioid settlement program. We would compare that proposal with the work that had been done to date in the program, and we concluded that spending did align with the proposal. Most recommendations were either implemented or partially implemented, and are still being worked on. The third observation was to review whether performance measures and oversight were established to assess the impact of opioid settlement spending and also gauge success of the program. So we reviewed their goals and performance measures that were in place, just the governance activities around settlement funds, and also made inquiries into the governance over opioid settlement funding from some of the other Tennessee counties. So the conclusion there was that the health department does have performance measures in place, but we did recommend for monitoring and governance of monitoring of performance measures and also governance should be strengthened. We have 5 observations. The first observation has to do with payroll allocations. It was a high-risk observation. So about $1.5 million of the settlement funds that were spent during the audit period were for payroll. So we felt it was important to do some testing around those payroll expenses. We reached out to there's about 34-ish employees that were receiving, that their pay was allocated to opioid settlement funds. We reached out to all those employees, just asked for a brief description of your job duties, and then what percentage of time those job duties reflected toward opioid abatement. When we got the responses back, I think everyone responded. We did notice once we looked at them as a whole that a lot of the responses seemed to be pretty similar. We had a few cases where someone would say their time spent on opioid abatement was 50%, and then a couple days later they respond and be like, I'd like to amend it, it's actually 100%. So it seemed a little odd, and so we did do some more work around that, and based on that work we found that the program manager was reviewing and asking some responses to be copied and pasted and editing responses, and just because of that management involvement, we did have to do a scope limitation and could not rely on that work for payroll. So the recommendation there is just to make sure that all payroll allocations to opioid settlement funds have some supporting documentation that can be reviewed. And also because settlement funds is finite and unpredictable, just to have a long-term funding strategy to ensure that those positions can carry on if the funding is depleted. Management did accept both of those recommendations. The second observation had to do with governance and oversight. So there isn't a formal governance board or committee that's dedicated to ongoing opioid settlement funding. There is the Public Health Board, of course, that's in place at the Health Department. We did look at all the meetings that were held during the audit period. And at the very beginning of our audit period, there was a brief discussion about opioid settlement funds coming in, but that was the only time that we found that opioid abatement was discussed. So since the initial steering committee provided their recommendations, ongoing decisions are basically internal within the health department. We did reach out to Tennessee counties, and we found that 4 of the 5 that responded did have some sort of oversight committee over opioid spending, opioid settlement funds. So our recommendation there was just to work with the mayor's office to establish some sort of governance and regular reporting, and they did accept that and said they were willing to create and work with the mayor's office for an advisory committee. And then observation C, there were 2 contractors that provided services during the audit period, Mental Health Co-op and Samaritan Recovery Community. There's 11 invoices that we reviewed. All were allowable within the contract scope. Supporting documentation, we did request, and there were some inquiries that we made. For example, there would be like a capital purchase. We would ask the health department, what was that capital purchase? They would have to reach out to the contractor and find out what that was. And so based on things like that, we figured that there does need to be some invoice review that is strengthened. There was some misapplied payments and a duplicate. One contractor was paid twice for the same invoice. So based on that, we just had a recommendation just basically to strengthen your program level invoice review. Management did accept that observation. And then finally, this is the 4th observation. Yeah. So the Opioid Abatement Council requires semi-annual reporting, and they request data like how much of opioid funds were allocated during a certain period, how much was spent on prevention, how much was spent on treatment, things like that, just broad categories. All 4 of the semi-annual reports during the audit period were completed. We did find some errors, nothing egregious, but where the allocation was wrong or the amount spent on treatment was wrong. And that information is posted on their website, and so just for transparency, it's a good idea to have that information be as accurate as possible. There is also, we reviewed the grant contract to make sure all the required reporting and the grant contract was completed. We did get the semi-annual reports that were required under the grant contract we received. No issues there. There was Section C7 of the grant contract that required quarterly disbursement reports. We requested those a few times, but we did not receive them. So our recommendation there was just to have a QA, quality assurance and reconciliation process for reports before submission, and just to make sure that they're accurate. And to any reports that are turned over to the state, just try to retain those locally as well. And management accepted that recommendation. And finally, a medium risk observation in reference to performance indicators. Like I said before, there are performance measures that exist within the health department for opioid settlement funds. So that was one part of it. But then the second part that we were asking questions around was, how does the analysis process work? How do you look at those performance measures and determine if you can gauge the success of the program, or maybe you need to pivot and try different strategies? We didn't get any supporting documentation for that second part, and so that's the basis for this recommendation. And so our recommendation there is just have a formal process to track, analyze, and report outputs and outcomes for the program, and that was a rejected recommendation. So all in all, we had 6 recommendations, 5 were accepted, and that last one was rejected. And that is it. Is there any questions?
And so just to clarify, the final observation regarding performance indicators was rejected in its entirety?
Yes.
Yep.
Okay. All right, just wanted to clarify if there were, I know there were potentially, I see the observation and there's recommendations within that, but I just wanted to clarify that in its entirety it was rejected.
I'm trying to follow why it was rejected. I read the management response, but I'm not, was it just rejected because they have their own way of tracking, so they feel like that way is like better than the recommended way, or?
Well, I'll open up.
I'm happy to address that.
Yeah.
Pretty much, we have been tracking opioid data extensively, more than most places across the country for several years. And there's a few counties in Tennessee who has what is a fancy dashboard, but the level of detail of information we put out way above any of them. We are just now making that digital and interactive online. And so that's the first piece. So it's nothing that we aren't already doing. Now, the second piece that's important is this program, Opioids Fund, moved to the Health Department in 2024. Okay? At the time that the period of the audit, there were only 2 contracts there. Those one to mental health and went to Samaritan. And those contracts were prescribed really by the steering committee to do treatment and recovery. So we have performance standards for those ones. Those by themselves, you are not going to see trackable changes in public health from those 2 things, activities, over time. Now, the good thing in Nashville is for the past 5-6 years, it's been trending down, not because of treatment and recovery, but because of these other activities that we are doing, the upstream factors. And so, yeah, we are already tracking those things. So that is not like we're getting 5 more fire guys and we can improve our response time. That's not the way it does in public health. Those 2 activities, 2 grants for treatment and recovery, are not making any dent in our tracking of public health data. We're tracking that.
And then I had just 2 more questions. For observation A, where it talked about the program manager, it sounds like maybe like coaching employees on like how to respond to this. Was there any type of like, was that addressed with the program manager? I guess that might be a question for the health department. Like, was that addressed with them? Did HR get involved or?
Right, so that's one that, so we have processes in place to address those kind of issues. They are being addressed. And so probably shouldn't be something that I get into.
Okay, but it has been addressed, okay. Okay, thank you. And then my last question was on observation C, when they talked about like that invoice process, where it says that one invoice included a capital charge for a vehicle, and then there was a payment that was incorrectly paid to a mental health co-op instead of Samaritan Recovery. Those seem like, I guess my question to us is, that's saying a medium risk. That seems like a pretty big risk as someone who doesn't do this every day. I trust your assessment.
Yeah.
But I guess why does that qualify as a medium risk over a high risk? And then how are we, I guess like how does something like that kind of like slip through the cracks?
So I would say it's a medium risk because we found issues where we thought that it could be improved, but at the end of the day, all the work that we had to do, there wasn't an issue with the funds. I mean, the vehicle that was purchased was a valid vehicle. So just initially, that initial step should have been actually verify what that capital purchase was. So I do understand your point, and there is some, it could have been a high maybe, but we just felt that because we didn't actually find any material mistakes. And
it was just more of like a documentation mistake, not like a misuse of funds.
Yeah, if there was like a misuse, or if we asked questions about it and that turned out to be something that wasn't allowable, then it definitely would have been a high risk.
Okay.
Yeah.
Okay, thank you.
So I guess to sort of build on that question though, so, while that vehicle itself was not inappropriate as it relates to the application of opioid settlement funds, because this is a provider engaging the community, using this vehicle for that purpose. But I think, to kind of back up from an oversight perspective, right, and look at it holistically. So one might say, given the Samaritan group, the number of people they serve, the overall population, a vehicle is appropriate or 2 vehicles are appropriate. But at a certain point, if it's 6 vehicles, then it's sort of like, well, red flag there, right? And so I think, from my perspective, I think in metro government, I find often that when we have large departments and they have, governing boards with oversight and they have particular charge, those folks are, I think we're very prescriptive as to the Board of Health, right? A doctor, a nurse, and otherwise, certain skill sets that are required by law to be represented on that board. But these are still volunteers. And so I, from an oversight perspective, I respectfully don't think it really is sufficient to say that, we have oversight from the Board of Health. If you all are not operationalizing into your agenda that there is a very specific, opioid update, they vote on these things, it's one thing for them just to be there. But to have had all those meetings and then this did not come up as a topic at all, can you speak to that disconnect?
Thank you, Vice Chair. Yeah. So let me
Vice Mayor.
again. So Vice Mayor, I'm sorry.
Okay.
So to be clear, this program moved to the Health Department in 2024. In fact,
where was it kind of before, or how did it?
So the money was sitting, and then there's the steering committee.
Right, it was sort of in limbo somewhat.
So there was a gap, and it's not. This is my third place managing this, so it takes a while to build the structure and the system. So what happened here is not unusual. The money comes. As a matter of fact, the way that the money is structured, you have to spend certain allocation by certain period of time. So it was I believe Metro Council approved that payment in July of 2024. So that's the first piece. Second piece is it takes a while to build any new program. I would say, this is just my opinion, that maybe things moved a little bit too quickly. The steering committee were very prescriptive, which is fund these 2 programs for treatment and recovery. I would not recommend that because I think all of our money, most of our money in public health, in health, goes to healthcare. When you allocate all of the money to treatment and recovery, it's like mopping the water instead of going upstream and fixing it. And so you got to be careful even with the steering committee because people have different roles and what they're doing is healthcare, not public health. So that I wanted to make that clear. So when the money came, it was entirely allocated to treatment and recovery. Now within the health department, they used part of the fund to hire staff. And I think hiring the staff, again, went too quickly. There were too many staff in there. Part of that was to kind of build direct care and build a gap in mental health resources.
I apologize. Can you speak to, though, on the recommendation of the steering committee, but does the Board of Health approve standing up this whole behavioral health department? Who approved that?
So during this audit period, there were only 2 contracts then. Those contracts were approved and recommended by the steering committee. That's that. That was the only 2 steps, which is the contract to Mental Health Co-op as well as to Samaritan.
Okay.
That's the only 2 contracts during the audit period. It was strictly based, and the audit says that, on the recommendation of the steering committee. Yeah. So if you are asking me as a public health professional, I wouldn't spend the money that way. You will see that in the RFP that we did towards the end of last year, where we gave out 11 different contracts that encompasses where we get more bang for our buck, those upstream factors of health. It is not unusual to have healthcare people advocating for the money going towards treatment and recovery, but that's not the best way to spend the money. So so there's really not a whole lot of oversight because it was strictly carrying out those 2 prescriptions from the steering committee. Now, from the time that I came in here for interview, I think I spoke to you, can go back, I'd already said that, the advisory council. The reason I didn't pursue that was because we had the steering committee report, we had BWAC, and so there were too many layers, there were only 2 things, so we were reviewing the program. That's what we did to start with. first of all, put a stop to the process of trying to provide direct care and use this money to provide direct care. Now, there are gaps in the county, no question about it. But that's a conversation that we have to have as a county. I don't think is the best use for this fund. So we'll put a stop to that immediately, and then we expanded the use of the other RFP to cover the more impactful aspect, and we are tracking the performance. And in opioid care across the country, across the world really, there's a finite number of things that we do. It's not like the steering committee reinvented the wheel. You look at it, it's the same thing you'll find that all communities are doing. So if you really have that's why it cannot be an oversight team, because I have an oversight group, which is the Board of Health. But I've been saying that consistently to elected officials. I'm absolutely okay with an advisory group, and we're working the mayor's office to do that. But again, when you are constructing that, because there are different interests in the county, if the advisory group is going to make the same recommendation that they made earlier to shift that money to treatment and recovery, we're doing ourselves a disservice. But we're working with the mayor's office to kind of construct that in a way that interests are not the prevailing factor, and what's more important is what is the best use of that money in the county.
I guess, if I may, Chair, as a follow-up question. So, in a larger body like the council, right, we have committees within that, general expertise, and we might stand up a working group within that committee to kind of drill down on a particular issue. The Board of Health is how many people?
7.
7.
Yeah.
Kind of small.
Yes.
Just saying.
Yes.
And so I think, we have, as a body over the years, when we have a special opportunity or a, specific response, Ms. Porterfield and myself serve on the Winter Storm Response Commission, right? Like executive order stood that up. I can imagine here across the nation when you had these opioid settlement monies, okay, we need to put something together. What I hear you saying is, had you been here and been able to sort of inform whether that steering committee or that initial process or the guidance or the guardrails for that might have been different. But to your point of we have so many layers, and getting to what is in fact effective oversight and transparency, I think what I'm hearing from you is that through the mayor's office, they're going to effectively combine the steering committee and the advisory.
So I don't want
how
to.
should oversight from your perspective look?
Yes. So to be clear, there's over 3,000 jurisdictions, local health departments in the country. And these are done different ways. Where I came in here from Maryland, some people have the advisory council, some people don't. So just to be clear. But the mayor has, and I'm trying not to get ahead of the mayor, because we've talked about this, there's a mayoral appointed BWAC group. Okay. And it is possible that the mayor has a subcommittee of that to work with us, but we're working on making sure that, again, for transparency and advisory, so I don't want to jump ahead of the mayor, but he's going to come up with a suggestion to do that.
I think my concern becomes if ultimately what you point to is Board of Health has oversight of everything that you do.
Yeah.
Like, can you just sort of situate it within the landscape of the Board of Health,
Yes.
you in your director capacity,
Yes.
the mayor's office, because this sounds like it's another thing stood up to the side.
No, that's not really what I
Okay.
meant. So again, I should say thank you to Lauren and Seth and the team for good conversation. It's really maybe more semantics here. It has to be an advisory group. It cannot be an oversight group for me because my oversight body is the Board of Health. But that's semantics. We have a draft of what the role will be. I did the same thing in Maryland for an advisory group for use of opioids funds. So fundamentally, we're on the same page. We're agreeable to that. And again, I know that that conversation is going on. It's not going to be the Board of Health. It's going to be a group, perhaps subgroup of BWAC or some form, but the mayor is going to make that final determination.
And will you operationalize regular reporting of the advisory group into your
Absolutely.
Board of Health meetings? So that your Board of Health.
We actually, so again, what you do is you go and look at what the meetings are. We are absolutely okay with doing that, but know that in between the meetings, we provide very regular updates to our Board of Health. But to be clear, we will do that. But
Meaning just you send them emails to say this is what's going on?
Emails and updates and different things. But if that's a suggestion, now just so if we have the Board of Health and we have an advisory group, we have something very similar now with animal care and control. So it's trying to delineate responsibilities between these multiple layers of groups that we have to be careful with. But keeping the Board of Health informed, starting an advisory group and being transparent, allowing input and decisions about where the funds go, we are absolutely on the same page and absolutely okay with that.
And then one last question, if I might, Chair. So in establishing these behavioral health positions internal to your department, how many folks are there and newly funded by the opioid settlement money?
Right. So I can provide the absolute number, but since I've been here, what I've done is completely stop any further hiring into the opioid fund. My goal is to push the money to the community. So 100% of the unrestricted funds, of the restricted funds goes to the community, 100%. It was 5.5 million, the last RFP. And the unrestricted funds, there's still too many FTEs there, but we have stopped for almost a year, no hiring. So when somebody leaves, we don't replace them because we want to free up the money also to go to the community. Also, the grant that Seth talked about, the grant is running out next year. And so we did apply for a renewal. So instead of the 23, 24 FTEs that's there, we've cut that down to 6. Because really it's not, I think, again, I am not saying that we all make different decisions. So I'm not talking about whether I would have made a different decision, but I'm not questioning the decisions. But I don't believe the role of the health department is in building up staff and providing direct care. Our role, and I had that conversation with a lot of the providers in the community, we're not here to compete with Mental Health Co-op or Samaritan. We are here to see where the gap is and support them. They do these things better than we do. If we need to build capacity, we need to understand where the gaps are and work with them to build that capacity, not to compete with them. So.
I appreciate that. I think that had been my concern in sort of ramping up that piece so largely in that context. And effectively, you're setting up a fiscal cliff, right, when you get to the end of that funding mechanism. So I appreciate your responses.
We've completely stopped that for over a year, completely stopped that trajectory of hiring direct care. We've stopped that for over a year.
I apologize, I haven't asked a whole lot of questions.
That's okay. Anybody else? All right. Thank you very much.
Thank you. Thank you.
Okay. We are moving to the Metropolitan Auditor's Annual Performance Review. Just by way of background on this, I'll go through just kind of the generalized scores that she's received on her review, unless, Lauren, you want to do that. And then ultimately, we will need a motion to give a merit increase or not, or what that should be. So everybody's clear on where we're headed here. Okay. So is that right? Mm-hmm. Did I get that right?
Yes.
Okay. So Lauren underwent a performance review based on comments that I think you sent us a survey.
Yes, you all
as well.
received a survey, as well as our staff received a survey, and then I did a self-evaluation.
Yeah. So the results of that are, and I won't go through like every reviewer comment on the more narrative sheet, but Lauren received a score of 2.41 out of 17 attributes, and that's a 1 through 3 kind of scale. just so you can kind
Yeah,
of.
3 is the top of the scale.
3 is the
That
top of
sounds
the
like that should
scale.
be said.
They
for the
don't like
public
me to
record.
say that,
It's for somebody at 2.7,
right, it's
you
like,
know.
that seems low, but it's not. That's
And that was
actually
the
really-
self-evaluation.
That was on the self-evaluation, okay, great. On the staff evaluation, Lauren received a 2.9 from her staff. You know, all successful and exceptional scores, no ones or need improvements scores on her evaluation sheet. So overall, I think another good review for Lauren. We're certainly happy to have you. Any questions about anything in particular?
The self-evaluation, is that, you did that one yourself?
Yes.
About yourself? I think it's very interesting that the audit committee scored you at almost a 2.7, your staff scored you at a 2.9, but you scored yourself at a 2.4. And I think sometimes we are our worst critics and we can be extremely hard on ourselves. But it appears that you are doing a great job, an amazing job. So just want to thank you for your service and your work that you do for Metro.
Appreciate it. I just see all the potential, all the things I want to do and that I have not done, that we're still working towards.
Limited time and
We all know that. A lot of people at this table know that feeling. Yes, yes, indeed.
I would like to make a motion. Is now the appropriate
Sure.
time to make the motion for the, is it the across the board increase, or what is it, what is the language that we need?
So I automatically get the across the board. It's in my employment letter. The piece that you all would be voting on is the merit increase, which is 2%. Technically, boards can give more, but we can't fund the budget for that, so 2% would be the max.
I move to do a merit increase of 2%.
Second.
All right, all in favor?
Aye.
Aye. All right.
Thank you. Okay. Let's see. Next, now we are finally onto our administrative items, which I'll try to go through fast since we've been here for a little while.
Really quick,
yes.
Lauren, on this, because we talked about it a little bit earlier, and I didn't want to take up time with somebody else's audit, but on the complaint dashboard, my recollection is that we do actually go over a complaint dashboard at one of our meetings per year, correct? About
Complaint, like the allegations.
the number of complaints that we're receiving into the
Call-ins.
Yeah, call-ins,
And I
all
believe,
that, and then their distribution,
Yes. So Vice Mayor actually brought this up at the last meeting as well.
Oh, okay.
Overall, annually we do that. In our annual report, it will tell us year over year how many we receive.
Yeah.
Each meeting on the project status, I can't really point you to a page, but in the project status section, we put how many we've received somewhat for this year. It's a little hard to gauge because it says how many we've received and then how many are open and closed. Well, some of the ones that are open were received in prior year. But we are working on trying to figure out the best way to present it so that you can see over time how many we're receiving, and maybe it's not just a stagnant year. When we do it for the project's status, it's more based on our audit plan year, because our audit plan year is very solid. But allegations, especially as we have been receiving more, would probably be more beneficial to be displayed over time. And so we are still working on putting that, and so that then you would have it at each meeting that you could see that.
That'd be great.
And then we could also break it down by how we receive them, which is something that I want to mention now, is our lead investigator, I think he left, he did a lot of groundwork for getting quotes for us for an external hotline. We are waiting till tomorrow for our new fiscal year, and we will be implementing or going on and setting up the purchase order for our selected hotline vendor. And then once that's in place, there will be like a Metro-wide announcement as well as on other materials to help as a third-party vendor. We already have multiple ways that people can contact us, but this is just another opportunity for people to feel even more secure because it is a third party. And that will be, those individuals can do an online form, or they can call somebody that'll be on staff 24/7 to answer those questions and fill out the form almost for them. So we will have that, and we hope that that especially will also give us even more of an uptick in the allegations we receive.
And if I may, Sharon, can I ask a follow-up question on that? From a communication standpoint then, I know, we've talked about, some of the positivity and a variety of means, right, to kind of submit some of these things, and sometimes the awkwardness of an elected official being informed about these things because people internal to Metro government feel that they hit a wall. It's like they went to, somebody in their own department, it was dismissed, they don't necessarily know how to escalate it, or they come to us. I'm always like, take it to the audit. But do you see both in kind of the opportunity to launch this audit to also then kind of communicate redundantly, but just about the other platforms and or avenues to do that? And has there been any contemplating, again, you don't want to say you must do it this way, whatever, so you don't, at that balance between there's so many ways to do it.
Yes.
Versus being hyper prescriptive, you only can do it this one way.
Yes.
Have you had a little
Yes,
more
we
thought
would
on that?
contemplate looking at, I would probably push more towards, which we're already thinking about this. We've got them on our website, but there's so many different ways. We always will have the opportunity and publish it that people can contact us, email, telephone, that's the easiest way. But with all these other platforms, since, like I said, with Hub Nashville one, it would be working on potentially phasing that out.
Okay.
And instead, if somebody searches for the word fraud, maybe it takes them to our website, or it takes them to another area that points them at one of these other avenues, so that we aren't, the vague ones tend to come from Hub Nashville, because like I said, people are searching for fraud or theft. And so we would probably start to phase that out, because like you said, it's redundant, and so what it does is it causes confusion.
Yeah.
And so that way, once we work to set up this online form with the platform that we're gonna use, making sure that it's comprehensive enough that we feel like whichever one we phase out is not, the opportunity is not eliminated by phasing it out. So yes, that consideration would be made.
Appreciate that.
Okay, so recommendation implementation, we had 11 recommendations that were due since the last audit committee meeting. 10 of them were reported as implemented. One needed a revised date. It was related to the OEM asset management audit. This was due to the recommendation itself related to putting policies and procedures around inventories for grant assets as well as operating assets. The operating assets piece of that has been completed. However, the person in charge of grant assets was out on extended leave. That person has now returned, so hopefully that will be done. They just need a little more time to get that one up and set up. I will note that our investigations, we don't put timelines on those. We are following up on the investigation or the recommendations related to the Metro Human Relations Commission. However, we have not been able to get responses from them. And so that is a situation, just to make you all aware. Paul has worked very hard to try to get documentation. We've been told about some of these things being implemented. We're just struggling to get some of the actual documentation to support it. Just to bring that to your attention, since that's part of what the recommendation, implementation, discussion is about. Outside of that, we have project status. We've got 11 projects going on right now. 3 of them are in draft report. We've issued 7 reports this year, and 1 investigation report as well. There are 7 audit reports and 1 investigation report. We've got a draft report for an investigation coming up soon too. So we're just continuously moving, and we're utilizing those consulting contracts, and we're working through our audit plan. Yes.
May I ask a quick question?
Sure.
So from an organization standpoint, I know sometimes when we kind of go to a document and I'm like, wait, this one or that one?
Yes.
Or are these here in time
Yes.
order? Are they in alpha order? Or
For this one, no.
Okay. Yeah.
It's the ones I could remember in the order that I could remember them, in all honesty.
I guess I might just ask if whether in the implementation status, because that doesn't necessarily seem to be chronological. I think sometimes I struggle a little bit to go find or look at the thing that I want, or anyway,
Sure.
whether, but that the manner of organization internal to the document it's
Consistent.
it's sort of, it's clear if it's alpha, if it's date, if it's status or otherwise. Because I feel like sometimes when I'm kind of checking back and forth across, I'm like, wait, is it this Metro government one or that one, or is it MEPS? Because we have a lot of repeat.
Yes.
Metro, right? So sometimes I know alphabetizing in Metro isn't great because then like all the M's wind up together, so, I apologize, please continue.
Sure.
Yeah, sorry.
Yes, we can do that. So that's our project status. Next, we come to our budget. We're rounding out the fiscal year as of today. The budget that's in there is a little bit shy. We'll still get another consulting invoice that will put our consulting budget right at the amount probably that we're supposed to have. We were under budget this year. Most of that was because of open positions throughout the year. For FY27, we were very lucky that we did get 3 of our 5 requested items. We got our rent escalation, our software escalation, and then half of the request for more consulting budget. We requested $150,000 for consulting because that's about the cost of a large audit. However, we got $75,000, which we are still thankful for, and we'll put to use. But we requested that. We did request some additional positions, but they were not filled. We also will have to cut 1.5% of our budget. Once that is loaded and we start to do the true-up process, we'll determine where that funding is going to come from. We've got some different line items that we can probably skim down, and then seeing typically, admittedly, we normally pull from consulting because our 2 largest buckets are salaries and consulting, and it's easier to cut a little bit from consulting. We don't want to cut anybody's salaries. So that's our budget. And lastly, we have our current status for our staffing. At the last meeting, we were very excited because we are making an offer to an Auditor 1. We did make an offer in May to an Auditor 1 who was we were waiting until he graduated. He accepted that offer, and then 1 week before he was supposed to start, took another position. So,
Into our office too.
yes. And then also we did have Courtney Grable Nelson, who was on our team for about a year. She left. She had a passion for policy and public relations, and you will likely see her on a re-election campaign for a mayor. Working on that, the opportunity arose that hit her passion and offered her the flexibility with childcare, and so we were excited for her, but unfortunately it meant we lost a very strong Auditor 1. So we now have 2 vacant positions. We're doing phone screens, about 15 of them this week. We're building off the register that we had that we offered the job to for the last candidate, making sure that we cover all those candidates to see if we want to make any staffing from that register. If not, then we'll have to post the positions and evaluate those. But we're working to get the positions filled. It's just unfortunate they all happened at the same time. But that's all I've got.
Okay. Anything, items for future meetings that anybody wants to? Okay, then I would, do I have to have a motion for adjournment?
It's a small board.
And then we're adjourned.
Just a call for adjournment.
You're adjourned.